Before complications occur in pregnancy, there are signs, and most times these signs are ignored. And if they are ignored, they now lead to harm to the mother or to the baby. But when these signs are attended to on time, when it is reported on time, and when the healthcare providers provide intervention on time, it will prevent potential harm to the mother or to the baby. That is why in this video, I am going to list 10 warning signs in late pregnancy that you should not ignore. Report immediately to your doctor or your midwife immediately you notice any of these signs. This will really save you a lot of stress and also prevent further complications to your pregnancy. Number 1 is bleeding. In late pregnancy, it usually comes from the placenta. Either the placenta has left the upper segment and now moved to the lower segment, blocking the cervix or almost blocking the cervix. This can lead to bleeding. Or the placenta has detached from the wall of the uterus. Where it is attached to the uterus, it has detached. And once it is detached, it will lead to a lot of bleeding. Now, these conditions are called placenta previa and placenta abruptio. This is very common in late pregnancy, especially from 20 weeks and above, when the placenta has fully formed. Now, by the time you begin to notice bleeding, you just stay and you start feeling cramps. From little cramps, you start seeing blood. From 20 weeks of pregnancy, please report at the hospital. It could be placenta previa or placenta abruptio. Okay. Number 2, when your blood pressure begins to increase or you start feeling dizzy, all of a sudden your ankles are swollen, your hands are swollen, you're having blood vision, you're having headache, severe headache, you can't stand straight, you can't move, you are extremely weak. And when you go for lab test, they will tell you that there is protein in your urine. Or when you go for antenatal visit, they will say there is protein in your urine and your blood pressure is higher than 140/90. This could indicate preeclampsia. Preeclampsia is very common in late pregnancy. It is called the silent killer. Yes, it is subtle, but it is very, very dangerous. So once you begin to notice all these things, please report at the hospital. All right, raise an alarm. I know if you do the blood pressure measurement and the protein test in the hospital and they see your result, they will not allow you to go without intervention. But in case you do it in a place where they may not notice, please report. Or you start feeling the signs, please report. All right. Number 3 is when you begin to urinate more often. You urinate too much, you are always hungry. Every time you want to eat something sugary, you are not always okay. And when you go to antenatal, when they do your glucose test, there's always plus glucose in your urine. This could be a sign of gestational diabetes. Now, when you go for ultrasound, you see that your baby's weight is bigger than the gestational age. This could be a sign that there is DM in that pregnancy. Now, what would you do? Report at the hospital. They are going to run glucose tolerance tests on you to really determine if you have gestational diabetes. And if the test is positive, they are going to start your treatment immediately. They are going to manage you with drugs, manage you with a dietary regimen, manage you with lifestyle modifications until you deliver. They are going to monitor your baby strictly, monitor the weight of the baby, monitor the progress of your baby. You are going to run routine scan, routine ultrasound for them to be sure that your baby is doing okay. See, diabetes in pregnancy is a handful. It comes with a lot of stress. Lastly, abnormal uterine contraction. When I mean abnormal, it's not yet time for labor. Probably you're around 29, 30 or 33 weeks. You start having contraction, not Braxton Hicks. I've explained how to identify Braxton Hicks. This one, the contractions are regular. They are coming at interval, and now you are experiencing it consistently. It's as if the baby is pushing down. You are obviously in labor. Once you experience it before your due date, report. Go to the hospital. It could be that it is preterm labor, and the baby may be delivered at that time and placed in the neonatal intensive care for proper management, or they may salvage the contraction and the pregnancy may continue. It all depends on the outcome of the diagnosis they will make. But please report, right? Report it. Don't waste time. Report immediately. Now, with all this I've listed, I know that my pregnant women, my pregnant mamas, are now aware of the signs that they should look out for. If you see anything abnormal, just report and save yourself and the baby, right? I always want to hear the voice of the mother and the cry of the baby, okay? Don't forget to subscribe to my YouTube channel. My name is Nurse Nelo. I'm a nurse midwife, and in this channel, I share pregnancy and fertility tips every day. Don't forget to click the notification bell so you'll be the first to see all my videos on pregnancy. Ask questions in the comment section and share the video to mamas that needs to hear it, okay? See you in my next video.